Hi there, hey, welcome back to my YouTube channel. My name is Chinay Obi. Today we'll be discussing the IUD, intrauterine device. Yes, lately there are two types of intrauterine device. There's one, the intrauterine device that contains copper, which is also called copper T. And there's another which is the intrauterine system, which contains actually hormones and the hormone progestin in it. These two IUC they actually do the same thing, only that with the difference that one contains copper, which is that wire that it comes with, a tiny nylon-like thread it comes with. That thread is actually copper, while the other comes with progestin, which is hormonal. So that is the difference between these two devices. The copper T actually, when inserted into the woman's uterus, that thread like drops off a little bit of it into the cervix and into the vagina. So, and usually it lasts for 24 to 36 months, which is 2 to 3 years, depending on your weight, depending on the level of the ionization of the copper, and also depending on the size. Because it is said that the bigger the size of the copper T, then the longer it stays in the woman. That's the number is efficacy. The longer its efficacy, or the smaller the copper, the smaller time for its efficacy. So this is how it works. And also it is also said that the longer, or no, the bigger the copper T, then the more cramps and the more blood flow. But the smaller the copper T, then the lesser the cramps. So you get how it goes. Then another thing with it is that the copper T actually relieves you from either thinking of taking the pills on a daily basis or immediately after any sexual intercourse, because when you take it, you're safe and free for at least 24 to 36 months. Then for the IUD, the one which contains the progestin, it actually can last for only 12 months, which is 1 year before you change it. So that is actually the difference between the both of them. So if you have a scare about whether you put on weight or not, then I'll advise you go for copper T, the one without hormones, because yes, it is known that hormones actually tend to make the woman put on weight. So if you already have the big body frame already, or you already have the tendency of putting on weight, you don't have to go over with the hormonal. Then if you already have heavy menstrual flow, I would actually advise you not to go for the copper T, because for some women it gets worse with copper T, you know. So yes, what are the precautions that should be taken while taking in having copper T? Number one precaution is you have to be faithful to your partner, and your partner has to be faithful with you. That's number one. Number two, ensure effective cleanliness. Number three, ensure you're not douching. Number four, ensure, and it's actually not advisable to do the fingering during sexual intercourse, because in the course of deep fingering, you might actually, the tiny thread might actually be displaced without knowing. It is also not encouraged for a woman who has had several sexual partners before now to go with having a copper T, because it is actually said that in the first 20 days pelvic inflammatory disease might show its face, especially if you've had several sexual partners, because during this time the body is actually trying to get used to this new occupant in itself. The uterus is trying to get used to the new occupant in itself. So anything that maybe if you've been having this pelvic inflammatory disease before now and it's just been silent, when this new occupant comes, the likelihood of it sprouting up is very high. So that is that. Then another precaution to note: if for any reason you have your IUD and you notice pain during sex, you notice lower abdominal pain, or you notice discharge, increase in discharge, especially if it's smelly, malodorous with an offensive smell, ensure you see your health provider immediately. And also that IUD will be removed while you be placed on antibiotics to take care of that infection. So yes, another precautions you should take while on the IUD is that for some women, or another thing to note, sorry, for some women there's a very tiny percentage of some women. What's that noise? Oof, sorry about that noise. Then there is a certain percentage of women, about 2 in 1,000 or 2 in 100 women, whom during cramps, during menses, yes, because I said earlier, depending on the size of the copper T, your cramps might be increased using copper T or using IUCD. Yeah, so for some women, during that cramps, during menses, the cramps actually displaces the copper T, and when it displaces it, that usual position of the copper T is altered, and when it's altered, it does not release effectively what it's supposed to do in order to avoid or prevent pregnancy, because it is believed that the one containing copper T ionizes and secretes into the uterus, making the uterus unfavorable for the sperm or the ovum to fertilize. So if for any reason, for this few percentage of women, if their cramps continues during menses, it tends to displace the copper T, and when that usual position of the copper T is displaced, the woman can likely get pregnant. That is why you hear some of this tale that a woman had copper T and still got pregnant. A woman with copper T, the baby had the copper T while in the hand while being delivered. This is actually the reason. It's actually a very minute number of women it happens to, but it is very, very possible to happen. So yes, just ensure that once in a while you check to see if you can feel that thread. If you can feel it, then it's still in place. But if for any reason you cannot feel it, yes, that's been displaced and you can get pregnant. But there is no study to say that the IUD being in the uterus can actually affect the baby. No. But if your health personnel can actually take it off even while you're pregnant, fine. But if they cannot, the IUD can actually be there with the baby and you have a safe baby without any issues. And also, it is not advisable to use the IUD if you've had an ectopic pregnancy before, or if you've had an abortion, or also if you've had if you're diabetic. It's actually not advisable to have the IUD inserted for you. Let me say it again. If you've had an ectopic pregnancy, if you're diabetic, and if you've had an abortion, it's actually not advisable. No, sorry, not abortion. It's what's it called? Endometriosis. It's actually not advisable to use the IUD. Then when should you put the IUD? It's actually safe to put an IUD just immediately after your menses, at the postnatal period between 6 weeks after delivery, and also just after an abortion. This is because at that time the cervix is slightly open and it will be easy to introduce the IUD into the woman without much pain. But for some women, even during this period, they still tend to feel pain. I know pain depends on the threshold of the woman. So yes, it is safe at those points. For some women, you might feel pain for some days or discomfort, while some nothing, they go about their daily life with it without any problem. Then for some women, you have heavy flow, continuous flow for some days. Some have might bleed earlier, might start their menses earlier than their usual date, maybe 2 days earlier than their usual date, and might bleed about 2 or more days more than their usual bleeding days. This is actually for some women. This is even at the time. This is the body trying to adjust to the new member or the new occupants in the uterus. That's why it happens. But for some women, within 4 to 6 months, the body adjusts and everything becomes normal. But if for any reason your bleeding continues 1 week, 2 weeks non-stop, or It's even after 4 6 months, if you can't deal, please go and take it off. It might not be safe for you. For some women, yes, I've had a woman who had that, and she bled for close to 2 weeks, and even after bleeding, she still had spots in between other days of the week of the month. She still had spotting, and I think she came to my facility in 3 months to take it off. So yes, if you're that kind of person, do not hesitate to go back for it to be taken off. So what else? What else? I think that is much about that. So with this, you have to check and see which is safe for you, which is safe from everything I've said. Which would you rather go for? IUD, yes, comes with cramps and heavy bleeding. For some women, it gets better after 4 to 6 months, but heavy bleeding is usually there, and the cramps. If usually you have that cramps and you're a kind of woman that has heavy bleed on a normal basis, then IUD is not for you, because if you usually have heavy bleeding and cramps, putting the IUD would actually double it. So that's how it goes. So I hope you took out value from this video. Once again, please do not hesitate to hit on the subscribe button if you've not done so now, and please like, share this video to friends and loved ones. Thank you so much for watching. Thank you for staying with me, and to my returning subscribers, thank you so much. Remember, like I always say, remember to stay healthy and create your happy place. I'll see you in my next video. Bye for now.